at the moment, the most realistic and close approach is simply a sort of restoration of what is damaged and destroyed by cancer. In many cases, except for medical therapies, but the majority of cases, what is done is an extensive surgery. And in some cases, a big part of the body is removed. Some important part of the body is removed because of surgery to remove the cancer and possibly surrounding tissues. What the regenerative medicine can do for sure now is try to rebuild what was removed from the body with normal cells, trying to restore the quality of life of those patients. Because living with big damage, with alteration in the face, in the function of the body, can be unpleasant after cancer. So try to restore the function. This is the most realistic. Then, of course, science is open and we can find, hopefully, many other opportunities to be useful to the people. Well, from the point of view of science, I can imagine that everything becomes possible because, everything not, but such amount of things that now we can even think, because 20 years ago we couldn't imagine such big improvement that were obtained recently, like induced pluripotent stem cell, like standard treatment for some kind of pathology or gene therapy, or how can I say, microRNA, or many kind of technology were absolutely far from our mind 20 years ago. So from the point of view of science is really exciting. To open, to increase our knowledge would be wonderful, will be wonderful. From the point of view of the patient and of the application, it's more difficult to be defined because, due to this new regulation and the cost of this kind of improvement requested by, the new rules and the regulatory authorities, make everything very difficult. And the normal development of a therapy, when it's very successful, when there is no problem, when the people has a very clear idea, is between 10 and 12 years. So a new therapy, if the proof of principle is given now, will be available for the patient later than 10 years from now. So we cannot imagine from the therapeutic point of view a big improvement, some improvement for sure, but not so much, because the time for developing this kind of treatment is very long. Now is very long, unless we change some rules or we understand some faster track to have these results.